delighted that you've all come. Got a big audience today. It will get bigger during the day. I think we've reached a tipping point. It's a overused managerial word, but what I, as in my clinical career, has been about is here's a digital solution. What's your clinical problem? And I think we've now moving the other way around to what's the clinical and business problem, and what can we do with digital technologies to help you? And I think that's a big shift. It's a big shift in the way we start thinking as clinicians. And we need to start moving around and embracing the whole of the digital technologies to solve our problems, as opposed to people designing solutions that we might not need. So, hang on, where are we? Were you supposed to have gone through those? There we are, good. So I want to thank Raj, Katie Cust, and the comms team for organising today. The objectives of today, from my perspective, are to start generating a conference on an annual basis by which the agenda is driven by clinicians. So your feedback today is going to be really key in terms of how we evolve this conference, because it should be about your learning, and it should be about us having a conference which meets your learning aspirations. So I think that's really, really important for us. I think there are different groups of clinical informatics specialists emerging and different groups of clinicians emerging in the clinical informatics world. I think there are those like me. I give up my clinical practice in terms of touching patients about just over a year and a half ago, and people say, oh, you've given up clinical, you're no longer a clinician. Well, you can't work in NHS digital unless you have a license to practice. And the reason is, and my answer to people is, if I get it wrong, I could kill up to 30,000 people a day, 60,000 on a weekend. Even at the worst as a clinician, I might damage 20 people a day. So when we talk about clinical and digital, clinical informatics has a massive impact for good, but if it goes wrong, it can have a massive impact for bad. So it's quite important that we see clinical informatics as clinical, not as techie or whatever. It is a clinical subspecialty, and we'll learn more about that as we go today. So broadly, there's the full-time specialists. There's those leaders who are often called CCIOs or medical directors, and there's a combination of both. This conference is to help clinicians use digital tools effectively. This is our main audience. Yes, we might be able to facilitate you becoming a CCIO or a specialist. We're going to evolve and become a mechanism for CPD and informatics for a mainstream clinician. When I say clinician, I'm a doctor. I have to live with that, but I'm talking about nurses, I'm talking about physiotherapists, I'm talking about social workers, okay? This is not a closed community. It's an open community for those who are registered and regulated. You are the participant, and you'll drive the agenda as we move forward. So it's quite an important difference for this conference. So you'll see in a session later on where we have a panel, we've already got 50 questions from you sent in. We can't do 50, but we will answer them all. But I will run an interactive session based on what you say in the auditorium, and if you don't say anything, I'll use the questions you sent in. So that's what I mean about you driving the agenda. So what's the state of play? We've got a lot to be proud of in this country. We've got an awful lot to be proud of. We've got paperless general practice with structured records. Quite a lot of I go around the world and they say, oh, we've got electronic GP records. So how much is structured? What analysis can you do? How much can you use that information to improve care? Quite often they can't. We've got a unique number across the NHS, so we can link records. We can start to give patients access to all of their data through their NHS number. We've got electronic prescribing. I've just been to Canada where they're struggling with even the concept of electronic prescribing at national level because they've got a regional government structure. We've got a national spine. It processes 2,000 messages per second. You know, that's up there with the big digital technologies of Visa. We have a national patient demographic system which interacts with systems in providers across the country, keeps simple demographic data up to date, sends a message about informal deaths so that people are not getting appointments after the death and creating distraught families. It's the soft side of technology as well as the hard side of technology, which we as clinicians can start to understand to improve the patient experience. We've got a massive modernisation programme, 4.2 billion. We've got a strategic clinical reference group, which for the first time has published what we require as clinicians from information technology as we go forward. Now that will be refined, it will become more important. But we're now starting to put markers down as a clinical community of what we require to do our jobs better. But we've got a long way to go. The key message I want to give is clinicians as a driver for change. And I'm talking about driving improvement in or adoption of digital technologies. It doesn't have to be new. There's something wrong in a system where between 20 and 60% of test results are never looked at. Surely digital should be able to help us improve on that. We've just had a WannaCry incident in which we're looking at technical solutions, which is good, absolutely right. But how do we as clinicians maintain the continuity of care if the NHS systems go down or the GP systems go down? Well, what would happen if the patient had all their data separately stored and they brought their data to the consultation? We could still work. So there are unique opportunities to think differently using digital technologies. And we as clinicians should be starting to drive the change. I think my business process can change in the way I handle clinical practice. So is there a digital technology there available to us? Does it work? Does it work for me with my patients or my clients? Is it safe and secure? And why can't we use it? I recently saw a very nice app presentation, I won't say which one, and I said, but it was about mental health. And I said, well, where's the data? Nobody knew. We've got to think about problems as clinicians downstream, and we've got to think through how we can help our patients. So this is a simple example of a medical device that if we don't get this right, we can get ourselves into trouble. So we've got great machine learning, and we do it in Centre A with digital technologies A and clinician group A. The machines do fantastic. Will it work anywhere? So with digital, we need to start thinking about extensibility as well as generalizability in the way we go forward. And we need to think about registration of apps, devices, in the way we go forward, so that any machine can work in any clinical setting with any digital infrastructure, not just the one setting. And we need to think about safety and how we do that. And we need to think about how we deploy that safely across the estate. That brings me neatly into the whole area of safety and security and trustworthy. So as clinicians, we can ask the question, where's the data? And if somebody can't answer where's the data, you've got to start to just get slightly anxious. Oh, I think it's somewhere in Asia. Would your mum, would your sisters, would your family, would your partner all think that's good? So we need to start thinking about some simple questions we can ask clinically. Has it been affected by a cyber attack? What sort of security have you got on it? Have you got a password? Is it password 1 as the password? Has it got a virtual private network? Has it got any antivirus software? Has the clinician turned off, or has the administrator turned off the antivirus software? Does it comply with safety standards? And probably the most important as we go forward, we as clinicians say to patients, I'm going to do this, is this okay with you? We share with our patients. So one of the big areas is, are we sharing with patients what's happening to their data? So in conclusion, I think the most important intervention in digital is you taking ownership. Can we, that's clinicians, technologists of all the various subtypes, work together to help you do your job better, quicker, make us have less mistakes, improve outcomes for patients, our key enabler, and enable patients to take more responsibility if they want to. Not force it on them, but enable them to take more responsibility.